Hey everyone, welcome to KSSP Podcast. I am Spencer,
And I'm Katie.
and today we're going to be talking about Rett Syndrome. So with Rett Syndrome, I just kind of did a little bit of research on it, so I'm going to kind of go over those facts, and then I think Katie has a question for me, and if, of course, she has any questions during, she can ask as well. So we'll just kind of get started. So what is Rett Syndrome? Andreas Rett was a pediatrician in Vienna, and they first described the condition in 1966. But those writings were in German, so it did not become widely known in the English-speaking world. I don't know when it eventually became widely known in the English-speaking world, but it wasn't until 1999 that the mutation for Rett syndrome was discovered. So it is still a pretty new, the condition itself has been around since 1966, but it wasn't until 1999 that we figured out that, what that genetic mutation was. And that was discovered by Huda Zogby, and I apologize if I mispronounced that. So Rett's is a genetic disorder. It is almost always a new mutation. Less than 1% of cases are inherited from the parents. It affects about 1 in 8,500 females, and it is generally exclusively in females because it is a genetic mutation on the X chromosome. And boys who have similar mutations on their X chromosome typically die shortly after birth or in utero. But there is a syndrome. It's Klinefelter syndrome, where men can have two X chromosomes, the XXY. So those can sometimes survive with the mutation.
Is that because they have two X chromosomes instead of one? I'm sorry to interrupt. But...
Yes. No, you're okay. Good. So that's generally why men don't usually survive with Rett syndrome with a typical XY, because it's on the X chromosome and it affects every single gene. Whereas women who have XX, it doesn't affect every single gene, is what I understood from reading about it. But I guess when I looked at, there's a good resource on, International Rett Syndrome Foundation is a good resource if anyone's interested in looking up more about it after we're done here too. But they discovered that some men can still have Rett syndrome, or the genetic mutation, as long as it's mild. So it kind of depends on how it affects them, on whether or not they can survive, but typically it's a female disease just because of it being an X genetic thing, like an X genetic disorder. And then here I have just kind of the typical signs and symptoms that you would see or could see, because again, it can kind of vary as well. But so they had it defined as stages. So stage 1 is early onset, which is 6 to 18 months of age typically. And it's often overlooked at that time because the symptoms are so vague. But some things that you might notice is less eye contact and reduced interest in toys, as well as delays in gross motor skills like sitting and crawling. And then stage 2 is the rapid destructive. And that is typically seen in ages 1 to 4. And with that one, it can be rapid or gradual. It kind of just depends. It's going to vary on a case-by-case basis. But with that, you're going to see, or could see, loss of purposeful hand skills, such spoken language. And then they also may show characteristic hand movements like ringing, washing, clapping, or repeatedly moving their hand towards their mouth, which is called mouthing. They may show breathing irregularities like apnea or hyperventilation. Some girls display autistic-like symptoms like loss of social interaction / communication, and or they may have an unsteady gait or slowed head growth. And then stage 3 is plateau / pseudo-stationary phase, which is typically in ages 2 to 10, but this stage can last for years. In this stage, you could see apraxia, motor problems, seizures. In this stage, there may be improvement in behavior with loss of irritability, crying, and autistic-like features. And then there may be more interest in surroundings / alertness, attention span, and communication skills may improve in this stage as well. And then stage 4 is late motor deterioration, which can last years or decades. In this stage, you're going to generally see reduced mobility, curvature of the spine, muscle weakness, rigidity, spasticity, and increased muscle tone with abnormal posturing. Girls who were previously able to walk may lose that ability to walk. Cognition, communication, or hand skills generally do not decline in this stage, though. So those are, I guess I would say, what they classify as the typical stages of Rett's, but there are still some variants. And when I was looking into it, it said there are 3 main groups, which are, there's a congenital variant, which is also, I guess, called Rolando. And that is a severe subtype, which in that one, it's development of patients and their head circumference is abnormal from birth. So that one is one of the severe forms of it. And then another variant is called Zappella, and I guess they considered that preserved speech, and that is a more mild form. And patients acquire some manual skills in language, can be partially recovered around age 5 in this one. Height, weight, and head circumference are often normal range, and good gross motor function can be observed. And then the third variant of the main variant groups was Hanfeld, I believe is how you say it, but that is called early epilepsy, and patients have epilepsy before 5 months of age. So I think we mentioned, I don't think the epilepsy usually comes until stage 3, which is ages 2 to 10, but in this one they basically kind of have the epilepsy almost from birth before 5 months of age. So that one is also, I would consider, a more kind of severe one too. I was also interested in kind of the mechanism of how it can happen, just how the genetic defect affects like the brain function or why. So again, there's still a lot of research that needs to be done, as with probably a lot of conditions, but they do have some knowledge on how things happen with this one. So for the genetic loss of that MECP2 gene changes properties of cells in the locus coeruleus, which is an exclusive source of noradrenergic innervation to cerebral cortex and hippocampus, leading to hyperexcitability and decreased functioning. And researchers have concluded that because these neurons are a pivotal source of norepinephrine throughout the brainstem and forebrain, and are involved in the regulation of diverse functions disrupted in Rett syndrome, such as respiration and cognition, we hypothesize that the locus coeruleus is the critical site at which loss of MECP2 results in CNS dysfunction. So basically, they think that since the gene affects those specific areas, and those specific areas are typically involved in what is abnormal with Rett syndrome, they think that that is kind of, could be a potential mechanism for why it happens.
So just to clarify, for
And
an
then
audience, CNS is the central nervous system.
Yes.
Yeah.
And then Rett's syndrome pathology, in some aspects, also overlaps the motor phenotype observed in PD patients, which is Parkinson's disease, which you can see with like the movement disorders, like the ringing that we talked about earlier, and then just losing the ability to walk. And those are kind of similar, I believe, is what they are thinking when comparatively to Parkinson's disease. So they said these results argue for an alteration of the nigrostriatal dopaminergic pathway in MECP2 deficient animals as a contributor of neuromotor deficits. So that's just another potential pathway of why the people with Rett syndrome experience those deficits. So definitely in depth. So I'm not going to pretend that I fully comprehend that either, but I just find it interesting. So I like to talk about it, I guess. And then, so for diagnosis has been kind of like prior to the discovery of a genetic cause, it was actually designated as a pervasive developmental disorder in the DSM, together with the autism spectrum disorders. And then some argued against this conclusive assignment because Rett's resembles non-autistic disorders such as Fragile X syndrome, tuberous sclerosis or Down syndrome that also exhibit autistic features. After research proved the molecular mechanism in 2013, the DSM-5 removed the syndrome altogether from classification as a mental disorder. So it wasn't until 2013 that we started designating it as a genetic disorder versus a mental disorder. And for diagnosis, there's certain criteria that has to be met, and for that criteria to be met, you just need to have close observation of the child's growth and development, and then conditions with similar symptoms must first be ruled out. And then I think the last thing that I have before the questions is just treatment. So there is no cure for Rett's. The main treatment that they focus on is improving function and addressing symptoms. And with this disease, females can live up to 40 years or more. And with advancements in medicine in general, that also has helped them live longer, and I could see that even extending in the future if we keep advancing medicine. And then actually in March 2022, Taysha Gene Therapies announced that they had received clinical trial application approval from Health Canada for a clinical trial of their investigational gene therapy for adult females with Rett syndrome. So I just find it amazing and interesting that they are still kind of, I don't know, that they haven't given up, I guess, in a sense. Like they're still looking into it and trying to figure out ways to improve their life, whether that ends up being a cure or even if it just helps improve people's lives who develop Rett syndrome. I just think that's amazing and it's just obviously, since it is deeply personal to me, since it affects my sister, it probably means a little bit more too than it might to some people, but just the fact that it is still that there's still kind of little known about, like we know a lot about it in a sense, but there's still so much that we don't know, and that we're still able to kind of research it and find things, I think is also really amazing as well. But I think that's kind of the overall view of what I had to say about it. There's probably a lot more that we could go into depth, but I do think that's just kind of I personally, when I was looking into it, that helped me understand it a lot more too. So I kind of hope it helped some people maybe understand it a little more, something that isn't common. So it's unique, I guess I would say.
Okay.
But then if you had a question, any questions, I am ready for those.
I just have one question here. So it's while Rett's is genetic, most cases are spontaneous genetic mutations. Is there any known cause of this mutation?
So from what I looked into and understood, like you mentioned, most cases are spontaneous, sporadic mutations. That's about 95% of most causes. And when I was looking into like the sporadic mutation, it said the mutated MECP2 gene is thought to derive almost exclusively from a de novo mutation on male copy of X chromosome, but it is not known what causes the sperm to mutate, and such mutations are rare. So they don't know why it happens.
Okay.
But it is still like sporadic, and they don't know why, but it is interesting, I thought, too, that it's just like a sporadic mutation on the male copy of the X chromosome too. Like that's interesting as well. But there is also the germline mutation. So it can be inherited from a phenotypically normal mother who have germline mutation in the gene encoding. But again, that's 95% of cases are sporadic.
Okay.
So then I think we have some special guests that we're going to bring on here today, because I think you have some questions for them too.
Yes.
And those special guests are my mom and sister. So we will bring them on here.
Hi, I'm Shelly, and this is my daughter, Brenna.
Hi, Shelly and Brenna. So I just have a few questions for you about Rett's.
Okay.
All right. My first question is, what symptoms does Brenna show physically and mentally?
Well, physically, she was never able to walk or talk. And mentally, she was always, they said, like at a 9-month level for her age, as in stuff that she was able to do. But yeah, she's never walked or talked. So that's mostly
Okay.
it, I guess.
Yeah. All right. And then, what is it like to care for and live with somebody that has Rett's?
Well, it's not easy because it's basically like caring for a baby because she's in a diaper still and she's tube fed. And so it's basically taking care of a baby, but it is rewarding when you can get her to smile or laugh. And she does love being around both her brothers, Spencer and Tanner, when they come in and say, "Hi, Brenna." She recognizes voices, and it's a lot to do, but but she's worth it.
Awesome. And then my final question, how old was Brenna when she was diagnosed? And then what was that whole experience like for you guys?
Well, she was diagnosed in 2005. So what does that make her be? She was 12. Okay. She was 12 when she was diagnosed. And it was kind of a relief when she was diagnosed because we didn't know what she had. And I remember that you just didn't know what her life expectancy was going to be, or if what we had to look out for and what we were up against. So when we finally found out, it was, a relief to find out and know what diagnosis we finally had.
So how long was it then between when you guys started to notice something wasn't right and then like when she was diagnosed? Was that like a long period of time?
Around 9 months old to a year. Okay. And then we took her to a gastroenterologist specialist because she was having reflux. And he asked me what our pediatrician said about her development. And I said, he said that she's lazy and there's nothing wrong with her. And then that doctor, the gastroenterologist, said, no, there's something wrong with her. You need to go see a developmental specialist. So then that started us doing that. And then she started doing therapies. And when we lived in Fort Dodge, and then when we moved to Sioux Falls, they have a 3 and beyond or 3 and up club that you can go through to the school. So she started school at age 3 and they had therapies there and stuff. So,
okay. That's good. Awesome. I think that's all the questions I have for today.
Okay. Well, thank you.
Yeah.
Thanks for having me.
The only thing, I have one thing, is just, do you have any resources I'll link them, I think, but if you have any, do you have any?
Well, there's on Facebook, there's the Rett Syndrome Family Support Forum page.
Okay.
And then there's also Aging and Rett Syndrome exclusively for those on the 17 journey with 17 plus age journey.
Those are on Facebook, you said?
Those are on Facebook, yeah.
Okay.
And then it's best, I would say, if people could find a Rett clinic as far as doctoring. And even if you go see them only just once a year, at least they know what they're doing and they have the best. That's because that's what they specialize in. Because when you're here and you're seeing just normal doctors, I don't know, they just sometimes don't know they don't know the disease or the syndrome, so they don't know how to address it. So I would suggest people find a Rett clinic if they could, because I think they're helpful.
Okay.
Okay.
I think that's it then. Thank you guys, obviously, for joining us.
Yeah. Okay.
Then we'll let you go.
Suggestions, you can always comment on the YouTube video. You can always find us on Facebook, Instagram, Twitter, and TikTok. And don't forget to like, subscribe, and hit notifications.
And we will see you next time.